Welcome to our video training session, Palliative Care, an Introduction to Concept. The program was edited from videotape of distance learning presentations held in January and March of 1999 at community colleges around the Commonwealth of Virginia. Participants came from hospices, home care agencies, and nursing homes in Virginia and Tennessee. During this video, you will see and hear the discussions at these sites. We begin our training with a question. What does palliative care mean for people with life-limiting illnesses? Here are some personal views of cancer patients taken from the videotape Managing Cancer Pain, a Rural Perspective, produced by the Virginia Cancer Pain Initiative under a grant from the Byron Carter Foundation. Let's listen to what Joanne and Kathy have to say.
I said that's how I was. I had got to the point where I didn't really want the chemotherapy. I have breast cancer, and it's like the non-curing kind. So it was like taking chemotherapy was just buying me time. And it was like the treatments, I wanted good quality time with my family. If I had a short time to live, I wanted it to be time that I felt halfway decent and wasn't doped up and aching, or even though I had the pain, it was like I didn't want to be to the point where I didn't know what was happening around me. I wanted to spend quality time with my son and my husband. And so I really had a doubt about whether I was going to come back for my second treatment of chemotherapy, which I just have taken recently.
Well, you know, my pain was so bad that I found that my time, when I would take my medications like I was told to take them, my quality time was a lot better.
Talked about the different areas that palliative care can be experienced in, not just hospice, but in nursing homes, in home care, and the different types of palliative care.
It was very good to include the fact that palliative care setting may vary. It may be at home, may be in the hospital, it may be in a nursing home. It can be practiced no matter where the patient and family is or are.
We discussed sometimes about how that just turning in the bed, repositioning, holding somebody's hand, personal type things that people can do to make a terminal patient or a chronic patient life more comfortable.
The aspect of touch and how nice that is in palliative care, to be able to make someone feel cared for and feel physically maybe a little bit better, and that feeds into the safety the issue and reducing anxiety.
Discussion here among our home health aides. We have 4 home health aides here that work at hospice on the Eastern Shore, and during our discussion concerning palliative care and our patients, we decided that control of their symptoms is a very important part, making the patient feel safe at home with their loved one, being available 24 hours a day is also a very important issue.
We were discussing what the focus of palliative care is, and most of them felt like it was comfort for the patient and the family, and treating the family and the patient as one unit of care.
Of course, at a hospice, most of our patients require some type of palliative care, and a lot of the focus of ours is to reduce the anxiety level, not only for our patients, but just as importantly for their families. And we feel that one reason a lot of people choose hospice is because of our excellent pain control record, the accessibility of hospice workers on a 24-hour basis, and also that most hospices like ours have a very